some of us, especially I guess the younger generation or the people who are on social media, have been seeing this very positive movement where people try to contribute themselves as part of the community. We have seen people donating online. I think there's a huge surge of donation on online platforms in Indonesia, like Kita Bisa or We Care ID, which is later then allocated either for providing masks, protection suits, or even cash or food directly to the communities that need it the most. We come together as a community and do our own kind of civil movements to complement the government. Resource allocation is the first step, and that's a good step. You know, the government has carved out this amount of money to be spent on these different programs. The next question, though, is the implementation and the targeting of these social assistances, right? On the one side, like we know that the government's leveraging existing social assistance programs, the administration setup in terms of, for example, using the existing Family Hope program, the cash transfer program through Family Hope assistance, where they already have a list of 10 million families in Indonesia who are receiving this assistance, for example. There's also the existing food staple program, the BPNT program, and so on. So I think there is kind of an administrative advantage, so to speak, where you already have a database of these people who are vulnerable and you want to reach out to them, kind of adding more assistance in this crisis. But at the same time, I think there's another challenge of, first of all, the shifting demographics of people who might not belong in the vulnerable or poor socioeconomic class before the pandemic, but because of the pandemic has lost their primary source of income. This includes people in the tourism sector, people in the informal economy sector, right? All this gig economy type jobs. You know, how can this people who might be categorized as aspiring middle class in the previous situation, but now are so vulnerable and might be going back to the vulnerable or poor, or as we like to call it, prasejahtera category here in Indonesia. I think in general, talking about the public in Indonesia, there is a general sense of kind of being on our own and uncertainty and inaction from the government side. There are ongoing conversations about how the public is not seeing the government doing enough in terms of doing tests on the ground. Indonesia has been ranked as one of the lowest tests per 100,000 population in Southeast Asia, and I think globally as well. So from the health perspective, I think there's that. And in terms of the social restrictions, there are some discussions around the need for government to be more serious, more aggressive in terms of maybe enacting a partial lockdown or some kind of measures to limit mobility related to the Ramadan, this pilgrimage kind of going back to their hometowns in rural areas or in the country. So in general, there's this sense of the government needs to do more. And of course, in the policy community, we know, and we've been looking closely at how the government has been trying to do some measures, right? There's the recently signed Perpu, kind of allocating resources for as an economic response measures through social protection programs, through credit restructuring measures and all of that. And there are some tests being delivered and so on. So I think there's a gap there where either, you know, it's a problem of perception, or actually the people are expecting the government to do even more to respond to this crisis. Because usually the mudik movement will start at the end of Ramadan, right? And we're just starting, so we haven't really seen big mass movement of people going back to the countryside or the rural areas yet. There has been some awareness raising activities that the provincial governments are doing, like in Jawa Barat, Ridwan Kamil has shared these videos of communities in the rural areas asking the city people to not bring the virus to their communities. For example, there are kind of this loose awareness raising activities, but I think ultimately the government needs to decide whether they will want to put a stricter, measures, actually banning people from going back home or not. And of course, again, this is a trade-off, right, between thinking about the social stability, because this is an important time of the year, but also how can we make sure that there are prevention measures in place, I guess, to minimize or to contain the risk of infection.